Go.
Okay. Hello, my name is John.
And I'm Cece.
Show them your face.
And I'm Cece. My daddy is going to be telling you about his knee surgery.
Okay, turn it back around now. All right, don't put your finger in front of the lens. Okay, as you can see, ladies and gentlemen, I'm going to show you that I have had a bilateral ACL surgery done about 3.5 weeks ago now. Okay, so this is what it looks like now. Actually, come up here and have a look. Okay, we're rolling again. Cece's going to come over here and she's going to show you my knees, and she's going to keep the camera on my knees now. Right, see. So this happened 3.5 weeks ago. Bilateral ACL surgery, where they took the hamstring, 2 pieces of hamstring from this side, 2 pieces of hamstring from that side. They will tie them together with sutures, and then they will drill a hole here and here, here and here. Then they'll have also an arthroscopy device with a camera that they put through here and through here, and also here, here, where they bring the new piece of ligament through, and they take it through the bone, tie it up, and then they plug it. Okay, so ACL is the anterior cruciate ligament, and you can see after 3.5 weeks that the stitches, dissolvable stitches, have started to fall out and fall away, and the swelling is starting to go down quite a lot now. This is heading up to 4 weeks on Wednesday. I had roughly 4 Wednesdays ago, 3.5 Wednesdays ago. So all this here was swollen. There was a lot of fluid. You wouldn't be able to see the muscle, the teardrops, or the side, the quads. On the side here, I've got a bit of bruising because of where they pulled the ligament through from the bottom and then plugged it. So there's bruising on there. There's a bit of bruising still here on the inside of the thigh. I don't know whether that's got something to do with the way they were performing the surgery, whether they were leaning on my leg or with utensils. Yeah, and they also had a marker. There was to mark out the areas where they were going to do the incisions and so forth. Here, you'll find that there's bruising here as well. My calf area was swollen, and also down to my ankles here. You can see this. Show them the bruising on top of my foot here. There's still a bit of bruising on top of. Not too close, Cece. Get back a bit so that they can see.
Put your foot down a little.
They can see it properly. There's still bruising there, and there's still a little bit of bruising here. Not too close, Cece. Further away, please. Yeah, there's still a bit of bruising here on the side. All this was bruised, completely bruised. All that, and you weren't able to see any of my veins because of the swelling that was going on. I wasn't able to move my knees too much. Cece, just stand back a bit, please. Right. And you weren't able to bend the knees too much. This is the sort of exercises that they get you to do.
And they want you to stand on one foot.
That's right. I'll explain that in a few minutes. Hang on a sec.
And show them how to do it.
And also pushing down, just make sure that you don't put your finger over the top of the lens. Pushing down like that also to strengthen up the hamstring area. The hamstring area, still up here, face me. The hamstring area is still very sore. I can't do things like, I can move around, right? If anybody's ever had this done, bilateral, just move back over there, Cece, so that they can get, just point down to here, all right? If you've ever had bilateral done, you'll know that the hamstrings get very, very sore.
Tell them what bilateral means.
Okay? And then, if you try to touch your toes, you can make it down there, but to try and get back up, you have to do it very, very slowly, because if you try to come up too fast, it'll pull, and that's where they took the slice of hamstring from. Okay, make sure you face the camera to me. When I'm talking, you face the camera to me. When I'm demonstrating my knees, you put the camera back down to the knees, okay? So what they'll do is they'll slice a piece. You'll see the videos on YouTube. They slice a piece off the hamstring, 2 pieces from each side, and then they'll suture them together, okay? And then they'll pull that new piece of hamstring through the drill holes that they make, okay? And then they'll plug them in the top part of the knees, which is the fibula, and then the tibia down the bottom, and then they'll seal it all up, and then you've got yourself new hamstrings. So then it's up to you to develop them, regrow them, take plenty of collagen, also take magnesium to decalcify any magnesium any calcification that's not going in the right spot. You take vitamin K. Vitamin K will send the calcium to the right places, which is your drill holes of the bone. So you've got to regrow that, and the collagen, what the collagen will do is help to rebond and form new blood vessels for that ACL that you've just had put in.